The old saying in medicine is, if it isn't documented, it didn't happen. Documenting the treatment you provide is a required skill, just like the treatments themselves. So let's review how to document your intervention properly. You need to ensure two things when documenting treatment. First, that you provide enough information that another clinician could do the exact same treatment. And second, that you're conveying that skilled care is being provided to your patient. When first learning how to document treatment, it's helpful to remember the acronym WWWPPA to remember the elements that are required in your note. You'll need to document what treatment was done, where that treatment was done, and why it was performed. You'll also need to include the parameters for any treatment done, the position the patient was treated in, and any assistance provided by the physical therapist or physical therapist assistant. By providing this information, you can ensure that the treatment is repeatable by the next clinician and will convey skilled care to anyone reviewing your documentation. The first piece of information you want to provide is what treatment was done. Be sure to be specific. For example, therapeutic exercise may include stretching, strengthening, or endurance training. Be sure to identify which particular one. Next, you'll want to identify where that treatment was applied. A common mistake is to overlook which side of the body is being treated, so be sure to include that information. You want to make sure to use specific reference to anatomical structures and your directional terminology to help guide the next clinician in performing this treatment. It is extremely important to include why treatment was being done. This is the opportunity to make the case again that your treatment is medically necessary. You always want to try and connect the treatment you're doing to a specific impairment or goal. When you can tie your treatment to a short-term goal or functional limitation, it helps make the case that this treatment was still necessary for your patient. Next up are the parameters you used for treatment. Based on the treatment being done, there might be one or two parameters that need to be documented, or a wide range of information that needs to be included so the treatment can be recreated. You'll also want to include what position the patient was treated in. Frequently, patients may be limited on what positions they can adopt due to their medical condition. When there's no medical restrictions, a position should be chosen to allow both the patient and the clinician to be comfortable and safe. Finally, you want to document any assistance provided and why the patient needed that assistance. Assistance can range from verbal cues to maximal assistance of multiple people to help a patient be able to complete treatment. Documenting the assistance necessary to complete treatment helps convey that the intervention was skilled care. So let's apply our WWWPPA acronym to a specific example. So what does our first W stand for? What treatment's being done? In this case, it's static balance training. Our next W stands for where. In this case, where stands for a particular location in space instead of a particular location on the patient's body. So our last W stands for, you guessed it, why. So as we discussed, we want to tie our why to some functional activity. In this case, to reduce falls during standing activities. Next up is parameters. In this particular case, parameters include the surface we're on, whether we're in shoes or not, our foot position, whether the eyes are open or closed, and how long we're holding each position. Remember, the goal is to provide enough information so the next clinician can repeat the exact same treatment. One of the other parameters mentioned was rest breaks. During a treatment, if a patient requires an excessive amount of rest, that should be documented as well. If a patient's able to progress through treatment with only brief rest breaks, then typically we do not document those. Moving on to the next component, position. Here our patient is tandem standing with their arms across chest, alternating which foot is in front. Both arm and foot position are important to document as they affect how difficult or challenging this exercise is for a particular patient. And finally, we want to document any assistance provided and why it was provided. In this case, our therapist is providing standby assistance of 1 to make sure the patient maintains balance and does not fall. So let's see how this information translates into written documentation. So here is a written statement of everything that was just performed in that previous treatment. Let's review all the components of our WWWPPA acronym to make sure that all the information needed for good documentation has been provided. So our first W stands for what? In this case, the what was balance exercise. When documenting what, make sure you put it in terms of what the patient did, not what the therapist or therapist assistant did. Our next W stands for where. In this case, treatment was done on a hard, flat surface. Again, depending on what treatment was provided, where may refer to a geographical location, or it may refer to an anatomical location on the patient. Next, we want to know why treatment was being done. In this particular case, treatment was being done to reduce the risk of falling during ADLs. So this ties our treatment back to one of our functional goals in reducing our risk of falling and making the patient more safe during activities of daily living. Next up are treatment parameters. When reviewing your own documentation, ask yourself the question, is there enough information provided so that another therapist or therapist assistant can recreate the exact same treatment? The second P in our WWWPPA acronym stands for position. In this case, our patient was standing with their arms across their chest. Make sure when documenting position to also include the use of any positioning aids that were necessary, such as bolsters, wedges, or pillows. The last piece of information we need to see is any assistance provided and the reason that assistance was necessary. In this case, our clinician was providing standby assistance to ensure the patient did not fall. When checking your own documentation, it's helpful to use this review process to make sure you have all the information necessary. When reviewing, make sure that you have what was done for treatment, where it was done, why it was done, any parameters used for treatment, the position of the patient and positioning aids, and any assistance provided by the clinician. Hopefully, this acronym provides a tool you can use to ensure that your documentation of intervention is thorough.